A warning to our viewers, some of the images in this next story may be disturbing. There are growing fears about a health crisis in Ukraine amid the Russian invasion. Medical services are being interrupted by the conflict, and critical supplies are unable to reach those who need them most. As Jamie Mauracher reports, experts say now is the time to help.
Bombarded with the casualties of war, doctors and nurses at this Ukrainian hospital work around the clock. Injuries are coming in at an alarming rate, while supplies and space dwindle.
We would overflow our hospitals in Canada in a day, and this is what's happened in Ukraine. And they're under the strain of constant bombing and not being able to operate during hours, and power failures and cyber attacks and everything else you can possibly imagine makes it difficult to function.
Toronto-based plastic surgeon Dr. Oli Antinishin has done countless medical missions in Ukraine. Without help, he says, its healthcare system will crumble. Patients have already been displaced, moved to makeshift maternity wards in bomb shelters and pediatric units in basements. There's a shortage of cancer medication, insulin, and oxygen. The Canadian government has committed $100 million in humanitarian assistance, some of which will help to provide health services. And the World Health Organization announced the first shipment of medical aid would arrive in Poland Thursday, including sutures, skin grafts, surgical equipment, and COVID-19 therapeutics. But the WHO couldn't say how it would get the supplies to those most in need. Lviv family physician Ihor Zastovny worries without it, supplies will be drained in mere weeks.
We've asked about a lot of things, but we need help for the wounded, mostly, I suppose, like the dressings, the CATs, the tourniquets, other stuff. There are a lot of stuff.
Antinishin, who is heading back to Ukraine, says the situation they are facing is comparable to World War II.
They're working in far less than critical circumstances. I'm sure they're fearing for their lives as well. They don't know whether they'll be able to function as a hospital from one day to the next.
A threat to the fundamental human right of health care that could take years to recover from. Jamie Mauracher, Global News, Toronto.